All right, it's lovely to be here. I'm going to give a bit of an overview to some issues around accessing biospecimens and data from human health biobanks. And I think then we should have plenty of time at the end for some discussion. So I'll start out with a broad introduction to biospecimen and data use with a focus on human health biobanks. And then I'll talk a little bit about the situation where many researchers who want to use human biospecimens and data are often opting to create their own collections or biobanks instead of using more centralized facilities such as the Statewide Biobank where I'm joining you from today. And then I'm going to talk a little bit about how centralized biobanks can better meet researcher needs, giving the New South Wales Health Statewide Biobank as an example. I often start talks with this slide because I think it summarizes these fundamental challenge and tension in doing biomedical research, and that is that we need to find an optimum balance between research quality and research quantity. So on the y-axis here, we have scientific productivity, and you can see that there's an optimum that's been reached in this particular case. If we have an overemphasis upon research quality, we can actually reduce productivity because we have researchers that become increasingly, risk adverse and overly attentive to detail. But then, of course, if there is not sufficient attention to quality, then we can actually have virtually no scientific productivity at all. So we need to balance these two things so that we can achieve progress, essentially, in the real world. In human biomedical research, there is an indication that there is an overemphasis upon research quantity as opposed to quality, and that was exemplified about 10 years ago when people started talking about the research reproducibility crisis. So the diagram on the left came from an article written by Monya Baker in Nature in 2016, where a lot of researchers were very concerned about the, the inability to reproduce previously published work. So here we're talking about the reproducibility crisis in research, and beyond our inability to reproduce studies, there's an additional problem in biomedical research in that we largely lack a culture of reproducibility, and that's because preclinical research, as many of you will know, is expensive, it's difficult, it's slow, and original research, because of those factors, original research is prioritized over replication studies, which are not prioritized or rewarded. So a lot of the preclinical research literature will never be reproduced. But certainly when people attempt to reproduce it, they run into all sorts of problems. So this is a prime example that has been running for a number of years. And I think the final publications for the reproducibility project for cancer biology were published either late last year or this year. They were led by Timothy Errington and Brian Nosek, and they reported, tremendous challenges in trying to reproduce. They originally aimed to reproduce 193 experiments from 53 high impact factor papers, and eventually, due to logistical challenges, they could only attempt to repeat 50 experiments from 23 papers, and they had all sorts of issues doing so. So we certainly have a lot of challenges in terms of reproducing the literature, and that, of course, I think that's a challenging situation in terms of trying to translate preclinical research to the to clinical care. So the next slide shows a diagram that we published about 7 years ago, just to summarize how biobanks support this kind of preclinical to translational and clinical research chain. So you can see that samples tend to enter biobanks through either clinical care or clinical trials, and then those samples go out to fuel discovery research, validation research through translational studies, and then essentially the wheel turns. But you can really see that biobanks and biospecimens support research at every point along this journey to translation of research to clinical care. There are, of course, a number of different ways that biobanks can function and different biobanking models. There are almost as many ways as classifying biobanks as there are biobanks themselves sometimes, but this particular group of models I'll come back to towards the end of the talk. There are what's called classic biobanks, which tend to be largely built around retrospectively collected samples. Prospective biobanks are biobanks where researchers work in partnerships with biobanks to collect the samples that they need. And of course, there's other population biobanks, archival biobanks largely built through through pathology collections, and biobanks that are data focused. So In addition to this kind of way of classifying biobanks, we think a lot about biobanks according to their research access policy. So this was first proposed by Watson and Barnes in 2011, where they referred to poly-user biobanks versus mono or oligo-user biobanks. Essentially, these poly-user biobanks are open access biobanks. They tend to be larger, formally constituted, and other terminologies are external biobanks or centralized biobanks, and I'll use both those terms in this talk. In contrast, restricted access biobanks tend to be small to medium biobanks that are set up typically to support specific studies. We don't know a great deal about how, particularly the restricted access biobanks are very difficult to learn about because they tend to be difficult to discover. But there's been estimates that there's possibly, for every open access biobank, there's possibly 10 restricted access biobanks, at least in the healthcare sector. So in Australia, we have a system where human research projects and biobanks are both overseen by Human Research Ethics Committees. So they approve the establishments of biobanks and research projects. And then there is an additional layer of governance through site-specific research governance to establish the local feasibility of projects. Since about 2010 in Australia, multi-site research projects can be overseen by a single ethics committee, but they require local governance approval at all additional sites, and the same is true for multi-site biobanks as well. So in countries like Australia, there's some evidence that people are experiencing what's called regulation fatigue. This was a publication that we published last year where we analysed the contents of comments on a petition to streamline ethics and governance processes in Australia. And this certainly revealed a lot of dissatisfaction within the research community here in Australia. So the fact that researchers, if they want to obtain samples from an external biobank, that requires another access process. And you can imagine that when people have already obtained ethics for their project, they've obtained governance approval, to go through another process to obtain samples from an external biobank can sometimes be a barrier. So how does this work? Well, researchers tend to apply to the biobank. Their application's considered. There's usually some to and fro discussion between the researchers and the biobank. Eventually, the application is approved. Then the samples are sent, and then they're used for research. And clearly, all of this takes time. And we learned from surveying biomedical researchers in Australia that time and cost of obtaining biospecimens is very important. In fact, these were the primary considerations when Australian researchers talked about, what were important to them in terms of obtaining samples from a biobank. So how could biobank access be made simpler for researchers? And I guess the answer is fairly obvious. It's essentially go at your own and establish your own biobank. So have a research project and a biobank in one. So now I'm going to talk a little bit about this process of people creating their own biobanks, which I'll refer to as DIY biobanking. So I guess what's the evidence that this is actually happening? There isn't a lot of evidence, in fact, in the literature about how researchers obtain human biospecimens and what's important to them. So I'm aware of 4 studies, one of which we published. So ours is the right-hand column here. So I might just go through these with you and just tell you about some of the major findings. So the first study of which I'm aware of was published by Mallard et al. In 2011. It was a US-based study that was a survey to largely interrogate potential users of a large cancer research bank that was going to be established through the NCI. So their target population was NCI-funded cancer researchers, biobank managers, and other people. They didn't specifically report the number of people who created or used their own biobank, but they did find that more than 50% of researchers reported obtaining biospecimens through their own institutions. So this shows this tendency for researchers to obtain specimens close to home. Lawrence et al. Then conducted a survey that was based in the UK. 198 biospecimen researchers replied to this survey, all of whom were PhD qualified biomedical researchers. Of that group, 38% reported creating or using their own biobank. And the focus groups that were associated with that study showed that researchers valued local and trusted sample sources. Klingler et al. Performed an analysis in Germany. So this was a larger study, 354 people. And all of the participants in this study were located at 10 different sites of the German Biobank Alliance. Again, very similar to Lawrence et al., just over a third reported creating their own biobank. And what was really quite surprising in this study was only about 12% of the samples that had actually been obtained from a centralized academic biobank, despite this study being conducted at sites where there was a centralized academic biobank. A lot of researchers weren't aware of the fact, and that was also, I think, a surprising feature of this study. So then Rush et al., which was published in 2022, we conducted a survey in Australia. It's a smaller study, but in terms of population, it's actually comparable to the others. We talked to researchers who use biospecimens, and surprisingly, 62% of researchers reported creating or using their own biobank, where cost and speed of biospecimen access were the most important to this group. So this is just some data from Lawrence et al. Showing that in terms of, if you ask people, how do you currently source human samples for your research? The most frequent answer was, I collect samples myself. So clearly, do-it-yourself biobanking must have some positives if so many people are likely doing it. Firstly, we can speculate that there's no need to make applications to access external biobanks. The biobank is essentially under the researcher's control and can be tailored to their needs. And this can be an attractive option because if you want to establish a small biobank, the resources that are needed to establish that biobank are usually already available within the research laboratory. Of course, there are always less positive aspects of DIY biobanking. Particularly a small biobank can limit the scope of research. For example, availability of control samples, which researchers might not think about when they're actually establishing the samples that they need. And there is some evidence, certainly if you talk to researchers, in a number of the studies that I mentioned before, if they talk to researchers about whether a sample availability has limited their research, many researchers actually say that that's the case. That was true in Mallard et al., and we found the same. We found the same finding in Australia. So small biobanks are likely to limit scope of research, and while it's very simple to establish a small, quiet biobank, I think we all know that quality biobanking is quite expensive to maintain and to maintain in the long term. If the biobank is established through a restricted access model, which seems likely given the number of restricted access biobanks that exist, there's less opportunity to share samples with other people. And essentially this can lead to a fragmented and inefficient biobank landscape where there are a lot of these small, invisible biobanks. So our other research that we've conducted with cancer biobanks here in New South Wales indicate that smaller size biobanks are associated with under-resourcing, and that can lead to reduction in the performance of QA and QC processes, listing in biobank registers, participation in biobanking research. All of these things become more difficult when the biobank is very small and has very few staff. And of course, the hidden status of these biobanks means that they're not captured by research users or policymakers. So essentially, what we have in many countries is we have this low-cost entry-level infrastructure, the ease with which you can create a small biobank. It's quite easy to access biospecimen in countries like Australia through healthcare, and this can lead to this fragmented biobanking sector with poor visibility, under-resourcing, and possible underuse of biobanks. Okay, so how can centralized biobanks, I guess, work towards meeting researcher needs, given that there is clearly some dissatisfaction within the research community, which is probably exemplified by people creating their own biobanks. So I'll talk a little bit about the New South Wales Health Statewide Biobank here in Camperdown, New South Wales, where I'm joining you from. So the biobank's aims are to enable new biomedical research in New South Wales, to attract new national and international funding. We are intended to partner with existing health biobanks to improve management of biospecimens for research. And we're also here to help to rationalise and centralise health biobanking infrastructure and counteract this tendency for new biobank creation, particularly where that's not required. So the Statewide Biobank offers services that are difficult to find elsewhere. So as Robert indicated, we have a very large storage capacity. We can store more than 3 million samples. We don't currently have that many samples stored at the moment, but that's our storage capacity. It's very large. We have extensive laboratory facilities with automated processing and storage equipment. We offer integrated biospecimen collection across the state through the New South Wales Health Pathology Network, which is our statewide pathology service. And we also offer linkage to health data sets through the Centre for Health Record Linkage, which is another New South Wales state asset. We largely operate through a prospective model. So we have very few established collections here. We largely work with researchers to collect the samples that they need. And so I'm going to just go through a few policies that have been established at the statewide biobank or at the state level that all encourage biospecimen and data sharing and are all to, I think, render the services of a centralized biobank more valuable. So the first activity that I'll talk about is some work in terms of participant consent. So this was actually started before I joined biobanking in New South Wales Health. So there was the desire to develop materials to enable consent from patients for future unspecified research to increase biospecimen and data reuse. So the New South Wales Health Statewide Biobank has developed a consent toolkit, which involves consenting principles and protocols, templates, consent forms, and a compliance checklist. And these are all freely available for people to use on our website. So it's expected that consent for prospective collections of the statewide biobank will comply with the toolkit, and we encourage the use of this by any biobank seeking consent from biobanking participants. Another initiative has been the biospecimen collection grants that have been running in New South Wales since, I think, 2019. So these grants allow researchers to obtain money to collect samples and store samples at the statewide biobank. These grants involve a milestone whereby samples and their data will be available to other researchers. And there is also support, the grant also includes support to link biospecimens to other health data via the Cheryl. So what we aim to do is, again, encourage biospecimen and data reuse and then to increase the value of biospecimens through data linkage. So we've spent a lot of time thinking about how we can also simplify access processes for researchers who are using these collections. So if I mentioned before, of course, if you've got an external biobank and you're having samples going to the research project, there's usually an access policy for that. But when researchers are using the statewide biobank, there is no approval process that's required from the New South Wales Health Statewide Biobank. So if you're a custodian storing your samples at the Statewide Biobank, we're essentially an extension of your research project. There's no access process because the samples are yours. In contrast, if other researchers want to access samples in the Statewide Biobank that have been placed there by other custodians, the custodian must approve those external access requests. And in that way, the custodians don't feel that they have lost control of their samples. They remain in control and they have a veto vote as to whether samples go to external researchers or not. We've also established in New South Wales a system of biobank certification, and that is to improve standards and to provide educational opportunities to biobanks, but also to encourage biobanks to join an external biobank register that is part of the certification program to render biobanks more visible. We imported the CTRNet certification program in 2016, and it has been running ever since then. We chose the CTRNet program for a number of reasons. Firstly, we realised that we needed a low-cost solution for our local cancer biobank community, and we felt that certification provided this value add through the registry that might benefit biobanks and researchers as well. The program is focused upon communication of standards through education and resource provision, such as SOP templates, which was something that cancer biobanks told us that they needed, particularly the small biobanks. And it's also a very flexible system in that it can be customizable for different biobank types. It offers the opportunity to register or certify or both. And it's also available to non-biobanking groups, such as members of ethics committees, through an education-only option. So the way that certification works is that people can register for certification. They need to complete an introductory module. And then once they have registered, they can gain exposure to the recommended operating procedures and the SOP templates. They can develop their own materials for their biobank, complete education modules, and then a proportion of biobanks can move through to certification. And there are a lot of educational opportunities offered through certification, and biobanks can choose the modules that their staff need to do according to their roles within the biobank. So this is the website where people can access the certification system. So we have had quite, it's been running, as I said, since about 2016, and we have 67 biobanks that are registered and 16 certified biobanks, and our register is unique within Australia. I've been thinking about the certification in terms of presenting to you today, and it also, I think, supports what I'm thinking of as the safe creation of new biobanks. It's probably inevitable that we will always need new biobanks, but if new biobanks are supported through a process such as certification, they're more likely to be able to engage with quality processes and to biobank, in a quality manner. So the final thing that I'll just talk to you about briefly is a biobank creation checklist. So this was created by the University of Sydney in 2012, and we're actively discussing how to, I guess, develop checklists to help ethics committees feel more empowered in terms of making decisions about whether or not requests to establish new biobanks are justified or not. So the aim is by not creating biobanks unnecessarily, we should end up with fewer underutilized biobanks. So the request for approval to establish a tissue biobank document was established in 2012, I think. So people were requested to provide quite a lot of information to the University of Sydney if they were to establish a biobank within that organisation. But very importantly, that request for approval includes a request for a rationale for the development of the bank in terms of the needs analysis, the customer base, and why alternative sources of tissue resources are not practicable. And very importantly, there's a requirement to specify contingency planning should existing funding become unavailable, and to talk about the duration of the tissue bank and what will happen with the tissue when the biobank discontinues. So in summary, I think we all know that carrying out scientific research is difficult, and when you're doing difficult science, it can favour easy solutions. So when research is difficult and expensive and slow, we can favour solutions that are cheap and easy and quick. And sometimes those can include, creating your own biobank. Certainly in terms of what matters to Australian researchers, it seems to be cost and time. And the third issue here is also proximity, which has been reported by other studies as well. So researchers do value working with trusted colleagues. So there are some challenges for centralized biobanks. We obviously face competition both from local biobanks and also from people who go it alone. The study from Germany indicate that centralized biobanks can often be relatively invisible within their research community. So often people are not aware of the existence of centralized biobanks to support their research. There can be real difficulties in accessing biospecimens, or these difficulties can be perceived. But at the end of the day, real or perceived difficulties can discourage people from using external biobanks. And finally, centralized biobanks are going to require some degree of cost recovery, and cost recovery fees are always unpopular with researchers. But perhaps researchers are not always aware of how much it's actually going to cost them to establish their own biobank and run that in the long term. So I think a challenge for biobanks is explaining that quality biobanking is worth the price for the sake of future research, which could also be your own. But our own interviews with research users also highlight the need for biobanks to be research focused. So to be focused on their external communities and not just on their own needs and their bottom line. And if they continue with their current approach, they could risk fading into irrelevance. So I just want to acknowledge the people who were involved in adapting biobank certification in New South Wales, which was a large group, notably our colleagues in Canada. Kathleen Phillips is overseeing certification at the Statewide Biobank now, and this is our team at the Statewide Biobank, my research team at the University of Sydney, and I'd obviously like to thank the Office of Health and Medical Research for their support of the Biobank, the Centre for Health Record Linkage, and also New South Wales Health Pathology. So thank you very much for your attention. I'm going to probably stop sharing my screen, and I think we've got quite a bit of time for discussion. We've got some polls that we can share with you. So I look forward to hearing some questions and also having some discussion. Thank you.
Okay, well, thank you, Jenny. That was fantastic. I'm sure there'll be lots of questions. Can I ask the audience, please, can you write your questions in the Q&A at the bottom? Would you like to start with the polls, Jenny, or how would you?
Yeah, we can do that. We can do that. We can put a poll up. Okay. We've just got a few polls, and I think you could probably predict some of the questions from the content. But I think we want to ask about, experience in creating biobanks, your own biobanks, experience in working with external biobanks, so actually applying for samples from another biobank, how that was, and just talking about how things could work better, I guess.
Okay, so I've got this this poll, Biobank Access. It starts off with the first question: have you created your own biobank? And I'm just going to launch this poll now, so we'll see what happens.
Aha. All right. Does anyone have any questions that they want to ask while we're doing the poll?
We do have a question from Cornelius Ebner. And that question is the collection of the New South Wales Biobank also open for commercial research, or is it mainly academic? And what does the informed consent say?
Yes, that's a good question. So the way that the biobank works is we don't have any established collection of our own. So we store samples on behalf of other custodians. So we are currently working with some commercial clients. So we are establishing some collections in collaboration with industry. We're certainly very happy to work with industry, but essentially we are guided entirely by the informed consent for each study, and that's different for each study. So that's one of the things that makes working at the biobank very interesting. We're working with so many different studies that have their own requirements and their own needs. So it's very easy. Yeah, we don't have any sort of standard consent that we use. We don't collect samples for our own purposes. We do all of this for other researchers.
Great. And we have a question from Isabel Navoa. She says, dear Jennifer, thanks for your presentation. Have you detected ways of improving the evaluation of sample access?
Yeah, I think that's a great question. And I don't think that there has been, this is, I think, a really underexplored area in biobanking. I don't think anybody's really studied that. I would suggest that probably what most people, researchers, value is speed. They want efficient sample access processes, but I don't think anyone has studied that in any detail, and I think that there's a need for that. There's a need to talk to researchers in more detail about their experiences trying to access samples, and what works and what doesn't,
Great. We have a question from Ninon Guichard of Galapagos, and she asks, what is your view on dynamic consent to encourage reuse of data without forgetting about donor rights?
Yeah, I should probably say I'm not really a consent expert. My background's molecular biology, so even though I've been involved in biobanking for a long time, I'm not really an expert on consent. But I certainly think that dynamic consent can be a very valuable model, particularly in, particularly for particular patient groups. I suppose there's a couple of issues with dynamic consent. You need a platform that supports that. Not all biobanks have got access to that, although dynamic consent models are being developed in Australia, for example, through the Australian Genomics Group, and there's also a group here in New South Wales that's, I think, looking at e-consent. So you need a good platform, and you also need ongoing support to maintain that conversation with donors. So I think it's certainly more resource intensive than a model where people consent once and then that's it. So I think that's a challenge in many environments, that we don't always have that the human support that's required to maintain a dynamic consent model. That's something that I think organisations need to commit to.
A question from Paolo Bonvicini. Professor Byrne, thank you very much for your brilliant presentation. What is, based on your experience, the best way to improve biobank visibility?
I think that's a great question too. I think it's probably working with your local researchers. I mean, over and over, the studies that I presented today, it's really clear that researchers tend to go with the option that they know about. And it's often something that's very close to home. So probably the first place to improve biobank visibility is within your own institution. You might think, well, everybody knows about us. We're a biobank, we're here, but a lot of people will not. You know, I think a lot of researchers are faced with the situation where they have access to a huge amount of information every day that they simply can't process. So a lot of things that you might think people know about, they simply don't know. So I think biobanks have, you know, the easiest way is to raise your own profile within your institution, and there are lots of different ways of doing that. Giving talks, perhaps sponsoring seminars, you know, posters, all that kind of stuff, but start local, I would say. Because the evidence is so far that most biobank use is local. But I think that said, there's also a lot of scope to improve your visibility beyond your own borders. But once you start to become more visible locally, you'll probably be more visible in a distant sense as well.
Great. Question from Maciel Galezny. Is the New South Wales statewide biobank also open for international customers? And how do you ensure donor privacy is guaranteed and according to your standards?
Yes. Are we open to international customers? Yes, in theory, yes. We are currently not working with any international customers, but we can do that. I mean, donor privacy is guaranteed because we don't store any personal data. We don't store that. Again, we're working with the custodians, so the custodians hold all of the data. We only hold enough data to know what samples are in our freezers. We don't need personal data for that. So our ethics approval actually does not allow us to store identifiable data. So if we don't have the data, yep, it's with the custodians, and it should, and then the security of the data is the responsibility of the custodians.
A question from Ines Santarino, sorry. Would it be possible to work with local distributors to share the samples abroad?
Yes, I think so. Yes. Yes. I mean, again, a lot of this depends upon what biobanks can or can't do, depends upon their own ethics approval. So how we share biospecimens is determined by what we tell ethics committees that we're going to do and what they approve us to do.
And by local distributors, this could possibly be commercial organizations that are distributing samples in another country.
Yes, I'm not sure. I'd have to think about that. I don't know that we've currently got anything in our ethics approval that allows us to work with commercial distributors in other countries.
Okay. Question from Alexander Avgustus. Thank you for a great presentation, Jennifer. Do you have any advice or experience on how to better streamline the process of biospecimen access for external requesters?
I think, yes, I do in theory. I mean, I think asking for the minimum data that's required to assess the application is important. It's very easy when people create application forms to just keep asking for information because it's easy to ask for it. So I think rationalizing application forms and thinking about the minimum data set that's required to assess the application is important. Having clear timeframes and clear communications with researchers so that you tell them what the process is, you tell them when their application will be considered. If there's a meeting date, you tell them when they will know about the outcome. So I think a lot of it is being really clear about the process and then adhering to that process yourself. But certainly avoiding things like application form creep and having very large application forms simply because they're very easy to create. They're easy for a biobank to create, but they're very difficult for researchers to fill them in. And also, I think, you know, not reproducing information that researchers have already supplied in their ethics approvals. So trying to streamline trying to combine elements of biobank access and not duplicating what people have already had to supply to obtain ethics approval. So for example, just appending the ethics approval notification and not having to re-describe the research project if it's already been described somewhere else.
Right. Well, there are more questions, but perhaps we should just take a look at the poll, Jenny.
Yes, I think the poll is stabilized by the look of it. I think we might, has anyone not filled in the poll? It looks like it's pretty stable, so maybe we'll end it. I don't know if I can press end. I can press end. I've done it. Okay, so now we can share the results. I might press that. I'm not sure what's going to happen. But hopefully, I think, can people see the poll now?
I can see, yeah.
Yeah. So very interesting. More than half people have created their own biobank. That's interesting. And more than half of the attendees have also obtained samples from another biobank, which is also pretty typical. I mean, I think that's what I'd expect. Okay, so if we ask about people's experience working with external biobanks, most people are saying it was somewhere between easy and difficult. Okay, so then if you've worked with external biobanks, comment on how you found their sample access processes. I can't see any answers there. And I can't see any answers to the long answers. But I'm sure there's some very interesting things that have been written into the poll. Okay. Can you see them, Robert?
Not at the moment. Let me just work on it.
Yes. Look, I might, while we're...
Oh, yes. I have.
Oh, you can see them? Oh, good.
Oh, yes. Question 4 was, if you've worked with external biobanks, please comment on how you found their sample access processes. Yeah. And the first answer was relatively straightforward.
Oh, good.
We've got 10 answers, by the way. The second answer, time-consuming and frequently unsatisfying concerning sample amount. Third answer, external biobanks mainly work with tables with samples described, so they just share the inventories and we may choose. Another answer, different for each restraint scope or scope that is so wide that it does not feel so real, lack of confidence.
Right.
Another answer, easy. It required an application with details of the use.
That's good.
Another answer, research networking. Next answer, some samples were of poor quality. Potentially the quality depends on the collection process. Time of access can be very long, which is an issue to work on R&D critical projects.
Yes, I think that's something that people have discussed. Timelines for industry can be quite different.
Another answer is turnaround times, very long, depending on specificity of sample, very expensive.
Right.
The next question was, how could biobank access processes be improved? There are 12 answers. I'll just go through them. First one, improved communication and visibility. Second, appropriate linkage with data, clinical and outcome data. Third, clear process for access and visibility of the type and number of samples available. Next one, common or streamlined access across networks so that researchers only need to apply once if they need to approach multiple biobanks. Having dedicated persons, especially on setting up contracts and quotations. Harmonization. Having an online platform to find the samples. Standardized MTAs and contracts. Clear pricing information. Still missing visibility. First step would be to make sure that the researcher community knows about the existence of those biobank samples. Second step would be to come up with harmonized processes across the world. Probably very clear access policies could be published on a website which is dedicated to the particular biobanks. Researchers can then be well prepared before starting negotiation with biobankers. Ask simple questions for the intended use. More transparency on information given about the patients. So Those were all the answers.
Yeah, no, they're very interesting. I'd say that I mean, a lot of those issues have been raised in previous research as well. I think in terms of sample visibility, it's interesting that, quite a lot of time and resources have been invested in developing biobank locators. I don't think there's any evidence that biobank locators are necessarily an effective way of promoting biobank use, but I think the research just hasn't been done. My gut feeling is they have to help, that they have to help, but nobody knows to what extent they help or what's the best kind of locator. And I think some investments have been made in locators, sometimes without enough perhaps consultation with researchers, such that the locators are very complex and difficult to use. Sorry, I'm typing in a few answers to other questions in the chat as well. So I'm not a very good multitasker, but I'm conscious of time. Yeah, and I think all of the factors are important. People have talked about visibility, the need for application forms to be clear and simple. I think I'd really love to have a copy of these answers. I think that would be really great to have and possibly share with the group as well. That would be, if people are happy with that. I think all of the answers are anonymized, so nobody's identities are in there. But it would be a helpful thing, I think, for us to take away and think about as a team.
Okay.
Yeah, there are still some questions open. I think I've typed a couple of answers. I think there's a question here about where donors cannot be compensated to share samples. Do you believe it's easier to create their own biobanks? Or is this applicable for whether donors who are and aren't compensated? Yeah, I don't really know. I mean, certainly in Australia, donors can't be compensated beyond, for example, helping people, perhaps supporting people to come to the hospital to have their sample taken with parking and things like that, because we can't actually buy and sell human tissue. So that's an issue. I don't know whether, I think, is this question about like donors creating their own biobanks? I'm not sure. Welcome to put something else in the chat if you'd like. Difficulties like CROs using cell specimens will be facing in the future. Yeah, I'm not too sure about that either, I guess. I'm not I'd say in Australia, there's not a lot of use of biobank samples by CROs. That might be something that happens in other countries. I think I did answer the next couple of questions. Yeah, rare diseases and issues accessing samples from patients who have not yet enrolled in clinical trials. I think that is often, very challenging. Sometimes you can try and find rare disease networks that might have knowledge about rare disease biobanks. Samples from babies can be, certainly challenging if you require samples. Sometimes you might be able to partner with pediatric hospitals or maternity hospitals, but those samples can be hard to access, and often the collection of samples from rare diseases requires long lead-in times. So it can require biobanks operating over many years to slowly collect enough samples from rare disease patients for them to be useful for research. So that's a challenge. I think we've probably talked a little bit about streamlining processes for external investigators. In terms of securing budget for the statewide biobank, we are funded by the New South Wales government, but we are funded on the condition that we help to consolidate, biobanking in one site. I think the government realises that it's not possible to support a large number of biobanks. So they've largely made the decision to support the statewide biobank, but with the expectation that more and more people use the statewide biobank services. And I think there's a question about how does the data linkage with Cheryl work? How detailed is the clinical information that's obtained? The data linkage is actually done by the Cheryl. There are certain health data sets that are available for clients of the statewide biobank. And I think the researchers, again, the custodians, work with the Cheryl directly to choose the data sets that are most informative for their research. But I think potentially there is quite a lot of clinical information that can be obtained. But this is really something where I'm also not an expert. So the Cheryl actually have access to these data sets and perform the data linkage using a master linkage key or something like that. Data linkage in New South Wales needs to be approved by the Population Health Research Ethics Committee. So it requires a specific form of approval. But we are piloting a system where if you are working with a statewide biobank, that any ethics committee can approve data linkage in conjunction with the statewide biobank because of our, consenting practices and that kind of thing.
Okay, well, it's now 3 minutes before the end of this session. It's been fantastic.
Goodness me.
A great way to start the conference.
Thank you so much.